You know, I get to introduce you to one of my favorite places on the earth. This is Mukinge Mission Hospital, northwest province of Zambia. We're starting right out front of the hospital. It's a beautiful day, but this is the Zambian flag and the little roundabout. Then we go into the hospital right here. This is the main entrance. And this is the sign telling everybody how often the visiting hours are. This is the administrative block. There are administrative offices on both sides. But what I love about this is that as you walk in the hospital, there's a cross right here on the floor, just reminding us what the mission of this mission hospital is all about. I'll show you the casualty over here. The casualty is another term for the emergency room. Let me show you the casualty right over here. Oh, here's the TB clinic. It's important to know that TB is a really prevalent disease in Sub-Saharan Africa, and this is where the TB clinic, this is where the TB care takes place at Mukinge. Not only will patients come here, but they'll also, the TB team will come to us out on the floor and out on the wards and see patients for us. This is the outpatient area here. Normally during the day, this is now the evening. Normally during the day, this is just packed with people. And this is outpatient. This is where all the people that want to be seen can be seen by a clinical officer. And then if they're really sick and the clinical officer has questions, they'll be seen by a physician right here in the casualty. This is the casualty. This is where they take care of emergencies, from asthma attacks to cuts to people in labor that need to emergently get to maternity, to just a lot of different things that they take care of here. But this is where the emergencies are taken care of. And it's just a small area, but it's very effective. There's nobody in here right now. Hello, Mumbi, how are you? We're taking a tour of the casualty, and this is one of the clinical officers, one of the best clinical officers. And how long have you been here?
4 years.
4 years, so it's awesome. I love her heart. She loves people. And anyway, she does a great job. That man's doing fine, by the way. I operated on him this morning. So you have 2 beds here, and this is where they take care of. What would you say the most common things that you see here?
Asthma, malaria, diarrhea.
Yeah.
And HIV-related conditions.
Yeah.
TB.
Yeah.
And COVID above all.
COVID above all right now.
Yes.
All right. Thanks so much.
Thank you so much.
All right. We'll go back here and we'll retrace our steps and go into the back into the hospital. There's a break in the action.
I'll cut that part out.
Yeah. Is he leaving? Are you coming back? Yes. All right. So now we're entering the hospital complex. I think there are 200 beds here at Mukinge. First place we'll go will be the female medical ward. There's a main hallway of ward, and then there's a veranda, and this is the veranda. Patients are out here on the veranda, which is a nice little area that gets a lot of sunlight. And then this is the main ward here of the patients, and I think it has about probably 15 beds here, including some smaller beds in the back. This is the nurses' station right up here. And you can get a good view of this main part of the ward right here. I'll show you the men's ward now. It's very similar to this. This is the male ward. Again, there's a veranda right on the outside. There's music going. I love that. So this is the veranda. They're not quite as busy over here. And then this is the main ward. And lots of patients here. And You can see the sign up on the end talking about the dangers of coronavirus. This is one of the things I love is they show television, and very often they'll show some Kaonde, which is the local language, singing and dancing. And I love that. So, hey guys. All right, I'll show you the area that I work, the male surgical ward and the female surgical ward and the pediatric surgical ward. Hey Davidson, how are you, man? Actually, before we get there, let me show you the eye ward. This is the eye ward where they take care of people that have cataracts and people that have injuries to their eyes, and different diseases of the eye. Mr. Fumpa is a very well-known surgeon here. He's a clinical officer trained in cataract surgery and eye surgery, and he's just very well known in the Northwest Province. And that's where he does all of his surgery. I love the picture of the big eye right there. All right, this is the male surgical ward. This is where we keep a lot of our patients, the male patients obviously. There's two sides, there's a left side and a right side. This is the little nursing station where they can see most of the patients. And there's a ward here that has about 12 or 15 people. And then there's a ward here. We can walk right through here. So that's the male surgical ward, and now we're going to pediatric surgery and the female surgical ward. Over on the right's the pediatric surgical ward. You'll see some kids with fractures and infections and things of that nature. These are all the kids that are here at the right present time. And then right over here is hey, we're doing a tour of the hospital. Okay. And then this is the female surgical side. And we're kind of busy here, so yeah. So, and then we have one little room here. This is specifically for burn patients, and there's one patient in there right now. Next, we're going to tour the operating theater. For many, many years when I was here, the operating theater was this little tiny building with small rooms and low ceilings, and it was just a very, very small operating room. Had two rooms. Well, now, because of some grants that have been given, there's a brand new operating theater that is a big, expansive, very modern type of building. So I'm anxious to show you that. We have clinics twice a week, surgical clinic, on Tuesdays and Thursdays, and this is where we do the surgical clinic.
So what is a surgical clinic?
Surgical clinic is where people come and see us that don't need to be hospitalized necessarily, but they have a surgical problem. So somebody may have a hernia. They come here and all of a sudden we see them, we examine them, we schedule them for surgery. So we'll see about 30 patients on a Tuesday and about 20 patients on a Thursday. And that's the clinic doors entrance. We'll see that in the inside. This is our entrance right here. This is one small operating room that we use for our dirty cases, cases that don't require, that are infections and things like that. We have two rooms here. We have another surgical suite here. And then we have our clinic rooms here, which are so nice. Here's where we see patients in clinic. This is clinic room B. And it's just a beautiful little room to see patients, plenty of room. And then there's another room just like that here, clinic room A. So we have plenty of room to see patients now. I can't open the door, but this is a doctor's office, so this is where we keep our books or anything that we need to keep private. It's right there in the doctor's office. I'll show you our lounge first, and then here's Dorica. Dorica, how long have you been here?
7 years.
7 years. And Dorica is so good with her hands. She's great at suturing. She's great assisting. And whenever I have a problem, she'll take care of me. So, right? Thanks, Dorica. This is the lounge. So we have a place where we can eat, warm up our food for lunch, and this is the lounge where we wait for surgery. This is our surgery board right here where we put the surgeries on. There's Friday's list. Mr. Fumpa has 14 eyes. I have 5 cases. And then back here, which we won't be able to go into, are our operating rooms. This red line means that everything past here is sterile, but there's 3 big operating rooms here. One to the right is for orthopedic surgery, one in the middle is for general surgery, and the one on the left is for obstetrics and gynecology. That's where we do most of our C-sections. Big, spacious, expansive rooms, easy to work in, great lights. As a matter of fact, we used to all use headlights at the old operating room because the lighting wasn't that good, but here we don't need them because the lights are so good. We also have a very nice recovery room and intensive care unit. This side is for the recovery room, and the other side's for the intensive care unit. But you can put basically 4 people on each side, and it's really made a difference because we didn't have a recovery room or really a dedicated ICU in the old building. This is named the Foster Operating Theater and ICU after Dr. Robert Foster, who founded Mukinge Hospital many, many years ago. Okay, we'll tour the pediatric ward now. This is a ward that takes care of sick patients that don't have surgical problems, that are kids. So it's called a pediatric ward. Yeah, this is dinner coming in. So every day the patients get 2, do they get 2 or 3 meals? 2 or 3 meals a day. At Mukinge, 2, so thank you so much. 2 meals a day, which is a blessing. Many hospitals I've worked in don't provide food, so just having food is a huge, huge blessing. So that's what he's doing with the cart right now. He's taking that to the different wards for them to have food. This is the pediatric ward. This is a respiratory room where they take care of kids that have pneumonia and asthma. This is a high care room where they take care of patients that have other problems, specifically mostly malaria and things like that. There's also oxygen available in this particular room. And then here are the different wards. This is the main ward right here. And you can see there's about, 7 beds on each side. And then we have this malnutrition ward here. You can see, and we keep this locked up and very, very warm because the kids need to be warm that are malnourished. Anyway, that's the malnutrition ward. I love this map. So, and then last but not least is the maternity ward. If you notice back there, there's the hospital garden. They take advantage of the space to raise different vegetables and fruits. I missed the play area in there. Oh, that's okay.
Yeah.
So this is the this is the maternity ward. And labor and deliveries to this side. We'll take a quick look in labor and delivery. 1A, 1A. We'll just peek our head in here because they're busy. But hey guys, so this is labor and delivery, and they have 1, 2, 3 places to deliver, and then an area for interventions back here. So are you guys busy? Busy? No? Good. All right. So let's look at this room right here. This is if we have a complex delivery, somebody that needs a vacuum delivery, or we have somebody with a tear post-delivery, we can take care of them right there. Then we go back into an area that's really kind of sweet. 1A, 1A. This is where we take care of the neonates that are small, the neonatal intensive care unit. It's amazing how small of children are in here and how many can survive at that small gestational age or that small weight. We've had, I think, survivors up to 800 grams, which is less than a kilogram. So that's, what's that, 1.1, about a pound. This room's very warm. Yeah. 1A. So it's very warm in here. These are the little ones that are all moms are breastfeeding, they're nursing into cups, and then they'll feed the little cups or the eyedroppers to the patients. This is the beautiful little kiddos in here. 1A, 1A. See how little, so beautiful, so small. So this is bubble CPAP. This is for the moms that have just delivered. These are the moms that have delivered several days ago. This is where a lot of the expectant moms stay. It's empty right now. It's being cleaned, but the expectant moms are here, and then other moms are here with their newborn babes. So this is another ward here. So really, I think that brings us to the end of the tour of Mukinge Mission Hospital. And you know, I've been coming here almost 10 years, and I can tell you that it's just amazing to see. I say it like this: it's just some bricks and mortar and some dedicated people who love Jesus and want to make a difference in people's lives. And they're doing it right here at Mukinge, and this is the facility that they do it in.